Can you hear me?
Yes, Dr. Sugat, we can hear you.
Good morning, good afternoon, good evening to veterinarian from the different regions in the world. You are welcome to Sri Lanka Veterinary Association second international webinar series. We have organized 16 webinars at the second SLVA international webinar series. Our resource persons are well reputed veterinarian in Sri Lanka, USA, United Kingdom, and Australia. Today our topic is Introduction to Veterinary Dentistry. Dr. Chandika Wickramasingha, our resource person, is happy to conduct a webinar. I would like to request from you all to subscribe SLVA YouTube channel and click the bell icon to receive the notifications. Without wasting much time, I would like to invite Dr. Sudhanta Malwarachi, the President of Sri Lanka Veterinary Association, to welcome you all. Dear President, over to you.
Thank you, Dr. Sugat, our immediate past secretary. And very good afternoon, very good morning, and very good evening, and good night, very good day for everyone. And I'm very warmly welcome everyone to this second session of International Webinar Series. Today the topic is Introduction to Veterinary Dentistry, conducted by our Assistant Secretary, Dr. I think today it is a very interesting session because most of the animals we are referring to veterinary doctors for other clinical incidences or treatment purposes, but mainly when we are having animal at home, we have to be very careful about the dentistry because they are not living in wild. So it is very interesting subject. And Dr. Chandika Wickramasingha is the resource person today. So he will go through the technical part of this session. And I'm really happy that most of the Sri Lankan members of Sri Lanka Veterinary Association and also international forums joining with this session. And I really thankful to everyone. And before we start, there's a ground condition that everyone please keep your mic muted to not to disturb the session. And Dr. Chandika will continue the session. And for the introduction, I appreciate Dr. Nuan will introduce our resource person. So, Dr. Nuan, it is your time.
Yes, thank you, Mr. President, and welcome all the veterinarians who are in the worldwide joining us with this very important session, who's conducted the veterinary dental session. Before I hand over the mic to our resource person, I would like to give brief introduction about it. Dr. Chandika Wickramasingha is a past royalist, and he graduated from our university, it means the University of Periodontia, and a very good reputation among his clients. Especially, he is very specialized for the cardiology, dentistry, and as well as the small mammals medicine. And also, he has obtained the training UC Davis, United States of America, and also the Malaysia and the India training as well. He has a very good reputation among the Wasawa community as well for the particular subject. And Dr. Chandika has been serving as one of the assistant secretary of the Sri Lanka Veterinary Association consecutive second years now, as well as he is a founder member of the Sri Lanka Veterinary College and the Society of Small Companion Animal Practitioners in SCAP, as well as he is a member of Global Dental Community World Wasawa, Dental Community of the Wasawa Association as well. Okay, with this brief introduction, I'm not supposed to get more time from your valuable session. Dr. Chandika, over to you.
Thank you, Dr. Nohan, for your generous introduction. I will first share the screen. Just we'll double check if everyone can see it. I hope you can see the screen now. Is it
Yes,
clear?
Dr. Chandika. Yeah,
Yes,
it's
Dr.
clear.
Chandika, yes, we can see.
Right. Okay. So the topic today is the introduction to veterinary dentistry. And sorry about this, like very broad and vague title, because now in Sri Lanka at present, like our knowledge about the dentistry in veterinary dentistry is like at a very primitive level. So that's why this title I chose as an introduction to veterinary dentistry. So in this lecture, what we are going to do today is to like have a very basic idea about the oral anatomy, and then to discuss one or two or three common dental problems, because like, you can't expect this to be a comprehensive lecture. It's not that we select one specific subject of veterinary dentistry. It's just a whole veterinary dentistry that we are just trying to cover as a preliminary lecture. So in this picture, you can see three photos here. Now this one is a rabbit photo. Now there is a really huge growth of the incisors. So this is a very common condition in rabbits, where they get this malocclusion of the incisors. So the treatment wise, it's going to be trimming of these. Now at this level, as you can see at this level, you can cut these teeth. So that's the treatment option. Under anesthesia, you cut these two, then the problem is cured. And the other picture on your right side, the cat mouth thing, as you can see, it's a very angry looking, painful, inflamed oral cavity. We call this disease entity as feline Gingivostomatitis. It's a cat specific disease. Only the cat family gets this disease, not the dogs and not the humans, they get it. And the characteristic feature is this redness at the back of the mouth. So we will discuss a little bit about this condition also. And this dog's photo, you can see a thing called oronasal fistula, the communication between the oral cavity and the nasal cavity. So this is mainly due to the advancement of the periodontal disease. So initially we are going to like touch a little bit about the anatomy and the nomenclature of the veterinary dentistry, and then in between the slides I will introduce these three conditions. So that's going to be the structure of this session today. Right. So there's a thing called dental formula in veterinary dentistry, even in the human dentistry, that's there. So before we write a dental formula, we have to like know a little bit details about some other things. One thing is there are different types of teeth. As you may have heard, even in the human medicine, there are 4 types of teeth: incisors, canines, premolars, and molars. So incisors you denote it by I, canines by C, premolars by P, and molars by M. As you can see here, there are 2 I's, the capital I and the simple I. So the capital I is for the permanent incisors, and simple I is for the deciduous or the milk teeth incisors. Likewise, the capital C and simple C for permanent set and the deciduous teeth. And there are 2 more words that we have to be familiar with. One is the heterodont and the other one is homodont. Heterodont, as the name implies, hetero means different. So different type of teeth. So like these 4 types of teeth. Now these mammals usually have heterodont teeth, whereby they have different shapes of teeth, different types of teeth. And versus homodont, that means similar type of tooth. Fish, amphibians, and reptiles, they don't have these incisors, canines, premolars, and molars. There's no morphological difference. All the teeth are the same. So they are called homodont as far as the dental structure wise, and the mammals have heterodont. And there is a common ancestor of all the present day mammals. So the dental formula for this common ancestor of mammals is like this. Now, if you can look at this thing, so altogether there are 44 teeth in this typical common ancestor of mammals. So that 44 teeth comes as 22 teeth in one side. So if you divide your oral cavity to left side and right side, at one side you have 22 teeth. So you multiply it by 2 and you get the 44. So this is the typical common ancestors number of teeth. So how this 22 comes is it's the teeth on one side of the mouth, either left side or the right side. So how you write the dental formula is like this. Now initially we say incisors, canines, premolars and molars. So incisors first, canines second, premolars third and molars fourth. So this 3 by 3 means now this is only one side, either left side or the right side of the oral cavity. Say if it is left side, left upper maxillary incisors are denoted here, and left lower mandibular incisors are denoted here. So there are 3 incisors on one side of the maxilla and 3 incisors on the one side on mandible. So 3 by 3. And canines 1 and 1. Premolars, there are 4 premolars on one side at the maxilla upper jaw, and there are 4 at the lower jaw. So likewise, now when you add all these number, it comes to 22. So that is at one side of the mouth, and that is multiplied by 2, you get the 44. So this is the typical dental formula of the typical mammal or the common ancestor. So now this pig, as you can see, has 44 teeth. So the pig in the evolutionary process hasn't lost the number of teeth. So he has the same number of teeth as the common ancestor. Whereas dogs and cats, when they evolve, the total number of teeth has reduced to 42 in dogs and cats 30. And the same way you write the dental formula, incisors 3 and 3, canines 1 and 1 in the cat, and the premolars, there are 3 premolars maxillary and only 2 premolars mandibular, and only 1 each molars maxillary and mandibular. So puppies have, now even the dogs have 42, puppies have 28 teeth only, and the kittens have 26. And also we get quite a number of rabbit cases also. So rabbits have 28 of the permanent set and 16 of the deciduous or milk teeth. And squirrel usually have 20 teeth, and the one exception is this gray squirrel, they have 22 each. And they don't have a milk teeth and a permanent set of teeth. They only have one set of teeth. So that's why it's only one figure here. So there are other few words that you have to be familiar with when it comes to dentistry. One is open-rooted and the close-rooted. So in the open-rooted animals, the root is open. In a sense, during their whole lifetime, the root manufactures or produces the tooth. So the tooth elongates lifetime. Like in rabbits and squirrels, their teeth are open-rooted. So the tooth grows over the lifetime. Whereas close-rooted ones like dogs and cats and also humans, once the initial growth is there, they don't grow after that. It's the same size, and if it wears off, there's no regeneration of that tooth. So that's what is meant by open-rooted and close-rooted. And this thing, this heterodont and homodont, we have discussed before. Heterodont means different morphological types of teeth, like incisors, canines, premolars, and molars. Mammals have that, and the homodont examples are fish, amphibians, and reptiles. They are all the teeth are the same morphologically. And deciduous versus permanent. Deciduous means the initial set, and the permanent set is the second permanent set. And so there are 2 types of teeth. So those type of animals are called diphyodont. Di means 2, so diphyodont. Whereas there are other monophyodont, diphyodont, and polyphyodont animals. Monophyodont means like the squirrel we said here, they only have 1 set of teeth. Most of the rodents are monophyodont. They only have 1 set of teeth. And diphyodont means the same thing that we discussed. Most mammals are diphyodont. And polyphyodont, non-mammalian vertebrates like reptiles and all those fellows are polyphyodont because they have several sets of teeth during their lifetime. And birds don't have teeth. So we'll go to this rabbit malocclusion first, because if I try to elaborate all these theory parts, it's going to be boring to you. So this is a typical incisor malocclusion of rabbits that we normally see. Now these lower incisors have overgrown, and also the upper incisors also have overgrown. If you closely look here, you should be able to see another extra small tooth here. So that is a second incisor, and that is, in normal terms, that is called peg tooth. So they have, apart from the maxillary two incisor teeth, they have two smaller teeth called peg teeth. So they have altogether 6 incisors, 4 upper incisors and 2 lower incisors. And out of the 4 upper incisors, 2 are very tiny teeth. So what you do when it comes to this condition, under anesthesia, you using the burr, the electrical kind of a burr, you cut it from here and you cut it from here, and the rabbit is perfectly fine from that moment. Now, previously, some time ago, the nail clippers of dogs were also used for this thing, but it's not really recommended, because when you cut it using a mechanical kind of a thing without a motor, there's definitely the root of the teeth will get disturbed, and there will be, now if they get disturbed, the direction of the tooth growth will differ, and then definitely this condition is going to persist, because now for the teeth to wear off, there has to be a proper occlusion. If there's no occlusion, it's going to grow, because there's no surface for the tooth to stop from going. So cutting from a nail clippers are not recommended. Even if you don't have a proper dental burr, you can use any mechanical kind of a device, motored kind of a device, so that there won't be any unnecessary strain on the roots. And this is not actually a rabbit, this is a squirrel, but the same thing happens in squirrel. Significant overgrowth of incisors, malocclusion of incisors. So the principle is the same. Under anesthesia, using a motorized instrument, you cut them close to the skin area. Now, unlike now, when you cut nails in dogs, you have to be very careful not to cut the inside things which contains the nerves and the blood vessels. But in these ones, you don't have to be afraid of that. You cut it at the very short, no problem, like that. So this is the incisor malocclusion, and now this is the inside of the oral cavity. Now this is the tongue and this is the hard palate, and they have 2 sets, 4 sets of premolars and molars. You usually call them cheek teeth, as they are as one unit. So now what happens in a abnormal condition is, in this malocclusion, now if you can see, I don't know whether this is very clear for you, the photo. Now these first 2 teeth, they have a small spike here. Usually they are really sharp spikes, so that they damage the tongue base, and it causes a really significantly painful ulcer, and the rabbit stops eating. So this lower cheek teeth, the spikes grow towards the tongue, whereas in the upper maxillary cheek teeth, the spikes grow towards the buccal surface, so there will be ulcers and painful lesions there. And now this is the normal occlusion of rabbit. Now ideally these 2 upper incisors are like this, and lower incisors are like this, and these lower incisors go and touch at the base of these ones. And now in this side photograph, I think you should be able to see these 2 tiny peg teeth here. Apart from the maxillary upper incisors, there are 2 tiny peg teeth. So these 2 are the peg teeth, and usually these lower incisors go and touch these lower incisors, which are sorry, not lower incisors, the upper smaller incisors, which are the peg teeth. So this is the proper normal occlusion of the rabbit, whereas this is the malocclusion. And if you happen to see or take an X-ray of the oral cavity of the rabbit, it would appear like this. So this lower incisor shape is like a chisel shape, and it goes and touches the small peg teeth here, whereas the big incisors are like this. And you should be able to see a nice line arrangement of cheek teeth like this, and they meet at the same level. And there are two instruments which are very important when it comes to correction of the inner malocclusions. Now this one, this first one, it's just outside. You don't have to open the oral cavity. It's just a matter of anesthetizing them and cutting it with the motorized device. But when it comes to this inside one, you have to make sure that the animal is 100% anesthetized, deep anesthesia, and also you have to have some instruments to keep the oral cavity open, and also you have to have some instrument that you can put inside and trim these spikes. So that's a bit of a challenging thing when it comes to trimming the inside teeth. So these two instruments will make your life really easier. This one is called the rabbit mouth gag, and this is the cheek dilator. So this you use to keep the mouth open, and this you keep the two cheeks out of the way. So this is how you place it. Now it's clear in this picture. To the two incisors lower and upper, you insert this instrument, and then this knob you turn so that it gets widened and the mouth keeps open. And usually when you do this, the cheek will just come inside and cover your vision. So the cheek dilator like this is used to keep the things dilated. So you can see inside properly, and then you can see if there are any spikes and you can trim them. Now in this one, there are no visible spikes, but this tooth has overgrown. So this one with a mechanized burr, you can trim it. And if this recurs every 2-3 months kind of later, you can think of even extracting this tooth. And now this has to be done under complete anesthesia, and there has to be at least like 1 or 2 trained nurses to help you, because one person has to monitor anesthesia and there should be another person to hold from this instrument, and also if you have oxygen or gas anesthesia to hold those things. So it's a team effort kind of a thing. And now for you to diagnose this condition, now this otoscope that we normally use to check inside the ears of dogs and cats is very useful. Now, when it comes to a normal consultation, a rabbit comes to you, like say, not eating and also having some saliva forming from the side of the mouth. So you highly suspect some degree of spikes inside. And then before going into the anesthetized procedure first, you can use this otoscope and you can insert this part inside the mouth of the rabbit, and rabbit will like chew on that one. So while he's chewing, you should be able to see, at least get some idea about the condition. You may not 100% confirm sometimes spikes. Sometimes you can see the spikes, but sometimes you may see some ulcer there, or else sometimes you see some like saliva accumulation here. You can get some indirect clinical ideas so that you can later schedule the proper under anesthesia procedure. And these two instruments will make your life significantly easier. Now in this picture, we saw, now this is the burr handle and this is a straight burr. So this is the one that you use to trim these kind of spikes here. So if you only have this instrument, it's going to be a little bit of a dangerous thing because it can damage the oral tissues. So if you have this, which is the Bur Guard, then you fix it to the burr handle, then it makes your life really easy and less complicated and less dangerous. And likewise, these kind of disc burrs with the Bur Guard, you can use to cut the incisors, or else you can use the normal. Now this is the normal burr, high-speed burr, which is which has a cutting edge kind of a thing. So that also you can use to cut the incisors, or else these kind of instruments, this is a disc burrs, also can be used for this purpose. Now this is, I just included this just to give you an idea about a like normal veterinary dental machine. So this a dental machine will have a few parts, like few gadgets. One thing is, now this is the air water syringe. Now this has two knobs. When you push one knob, you get a pressurized airflow. And the other knob, when you press it, you get a water stream. And when you press both together, you get a pressurized water flow to wash the mouth, and that makes your life really easier. And this is the low speed burr, low speed handpiece, which is used for polishing the teeth. Now there's a small polishing tip that you can fix to the end of this instrument, low speed handpiece. And then there are like polishing paste also. With the polishing paste and this tip, you can do the polishing. And this is the high speed handpiece, which can be used for trimming the teeth of rabbits, as well as cutting the teeth of cats and dogs when it comes to multiple rooted teeth. And the rightmost one is the normal scaler. So this is used to, this is a ultrasonic scaler. So this is used to, like in humans, to remove the tartar and all the debris. So once you remove the tartar and debris, you can use the pressurized airflow to remove all the debris. So that makes the life easier. And apart from these four parts, some dental machines will have a thing called sucker. So that has a sucking device. So all the extra saliva which is accumulated inside the oral cavity, without any issue, you can suck them. So after that, if we again go back to the theoretical thing, so there's a thing called Triadian system of tooth numbering. Now, when it comes to a person in Sri Lanka or USA or UK or Singapore, Australia, when it comes to veterinary dentistry, if you have a universal numbering system, any person would understand what you are talking about. So people have developed this Triadian system of tooth numbering, which is the commonly most used tooth numbering system at present. So in this system, each tooth is given a 3-digit number. So that 3-digit number identifies the quadrant of the tooth and the position of the tooth, and whether it is a permanent or deciduous tooth. So the quadrant means now you have left hand side, right sides of your mouth. So a left side will have two quadrants, the upper quadrant and the lower quadrant. Similarly, the right side will have two quadrants, the upper one and the lower one. So there are 4 quadrants in the oral cavity. So this 3-digit number would identify in which quadrant the tooth is situated, and in that quadrant the position of the teeth, the tooth, and also whether that tooth is a permanent or a deciduous tooth. So this is even though very simple 3-digit numbering system, this is a very comprehensive. This gives a very comprehensive idea. So this out of the 3 digits, the first one denotes the quadrant. So as I told you, there are 4 quadrants. So you say right upper quadrant, right lower quadrant, and left upper quadrant and the left lower quadrant. So the first digit of the 3-digit number is the quadrant. And so usually you start numbering with the right upper quadrant. Right upper quadrant of the animal is the number 1. And the left upper quadrant is number 2. And left lower quadrant is number 3. And right lower quadrant is number 4. So 1, 2, 3, 4 goes as the 4 quadrants, and 1, 2, 3, 4 is for the permanent dentition. And when it comes to deciduous teeth, it goes as 5, 6, 7, 8. So that is also included here. And the second and third digit refers to the position within the quadrant, with the sequence always starting at the midline with the first incisor. So you can name it from 1 to whatever the number of teeth you have, 1, 2, 3, 4, 5, 6, like that. And there's another rule. If you remember this one, it makes the life easy and it makes less confusion to you. That is a thing called 4 and 9 rule. So which says 4 is always the canine tooth, and while 9 is always the first molar. So if you can remember this, when we go to the next slide, it will be easy for you to name the tooth. So always the number 4 is canine, and number 9 is always the first molar. That is the second and the third digit. So 4 means 0, 4. 0, 4 is the second and third digit. That is always the canine, and 0, 9 is always the first molar. So this is the full dental picture of a dog. So as you can see, there are 4 quadrants here. Now this is the right upper quadrant, this one, and this is the left upper quadrant. So that is the maxilla here, and the mandible here, the left lower and the right lower. So now there are several numbers with 3 digits. So we told the first digit of the number 3 digit denotes the quadrant. So this right upper one is the number 1. So all these teeth, the number starts with 1, and left upper is number 2. All these numbers start with 2, and left lower starts with 3, and right lower starts with 4. So that is 1, 2, 3, 4. And when it comes to deciduous teeth, it goes as 5, 6, 7, 8. And the next 2 digits, we said it denotes the position of the tooth within that quadrant. So if we take this this quadrant first, the first quadrant, so now these teeth are the incisors, then canine, and these ones are the premolars and molars. So on this side, right side, there are 3 incisors. So the first one is 0, 1, second one is 0, 2, third one is 0, 3. So that is the second and third digit, and the first one is number 1 because it's the right upper first quadrant. So this tooth has a number called 101. So that is the right upper first incisor. So when you say 101, anybody would know where that tooth situated is. And we have a rule, 4 is always canine and 9 is always the first molar. So this comes as 04 in the first quadrant, so 104. And this goes as 5, 6, 7, 8, and 9, 10. These are first molar and second molar. So likewise, similarly, it's the same on the other side also. 204 means second quadrant, the canine, and 209 means second quadrant, the first molar. And similarly, all these things are the same. Only difference is the quadrant is different and the other numbers are the same. So these 301, 302, 303 are incisors. 304 is canine, premolars and molars. So this may be confusing initially, but when you get used to it, it becomes like really easy system to follow. So a little bit to facilitate to get this idea. So as we told, the adult dog will have 42 teeth and the puppy will have 28. So the dental formula is like this. Now this I denotes the incisors and it is capital. So this is a permanent set of teeth. And this is the simple one is the deciduous one. So you can write the dental formula like this, and you have this rule 4 and 9 rule. 4 is canine, while 9 is always the first molar. So initially we looked at this orientation. Now this is the side orientation, but it's the theoretical wise, it's the same. So this is the first quadrant, the right upper quadrant. The first tooth is 101, then 102, 103, and 04 is always the canine. So 104 is the canine of the first quadrant, and 09 is always the first molar. So this is the first molar of the first quadrant, right upper quadrant. Now, as you can see here, now this small tooth is 109. This is the molar, first molar and second molar. Whereas here, 9 is this one, the big one. So in a dog, now this one, this one, this one, and this one are the 4 bigger teeth. So they are called in normal terms carnassial teeth. So carnassial teeth of the maxilla, the upper jaw, is not a molar. It's the premolar, because molar is starting from this one and this one. So carnassial tooth or the big tooth of the maxilla is a premolar, whereas carnassial or big tooth in the mandible is the first molar. That also you can keep in mind. So this is another orientation. The same thing goes. This is the left side of the mouth. So this is the second quadrant and this is the third quadrant. The numbering goes like this from 1, 0, 1, 2, 3, 4 is the canine and 9 is the first molar. here the 301 and 302 is missing because you can't see it from there, but it starts from 301. So in a cat, it goes like this. The same rule, 4 and 9 rule is there, and they have 26 deciduous teeth and 30 permanent teeth. So formula is like this. And when it comes to a graphical interpretation, so now this is the first quadrant, the right upper quadrant, and second one, third one, and fourth one. So this is a bit confusing. Now up to here, no problem, because there are 3 incisors, 1, 2, 3. So this is 101, 102, 103, and 104. Now the rule says 4 is canine and 9 is the first molar. So this is the first molar. So you number it from here to here. If this is 9, this is 8, this is 7, this is 6. So there's no 105 here. So you can't name this tooth as 105. It stops from here and then starts from here, 109, and then you go from 9, 10, 11, like this way, the molars, and premolars, you number it backwards. And this side also the same. And in the mandible, you have only 2 premolars. So now 309 is the molar. So you have only 2 premolars, 8 and 7. So the 6 and 5 are missing. Missing in a sense, during the process of evolution, they don't have a 4, 5 and 6. So you can't name this tooth as 305 because it has to come from here, backwards here, and then molars forward here. And rabbit's dental system is also the same. Now we said in the maxilla, the upper jaw, you have 2 major incisors and 2 tiny peg teeth. So those are numbered as 101, 102, and 201, 202. And the lower ones, 301 and 401. And the molars and premolars are the same. And the major difference here is now they don't have canine teeth. So after 301, they don't have something called 04 because they don't have canines. And the first molar is 309. So the premolars are named as 8 and 7. So they don't have 6, 5, 4, 3, 2, they don't have. So that's why they only have a limited number of teeth in their oral cavity. So this is the condition that we briefed in the first slide, which is feline Geostomatitis. So this is a very painful oral condition, which is specific to cats, or rather the cat family. So this is a feline specific, severely painful condition. And as you can see from this diagram, you definitely expect a significant degree of pain here because it's really inflamed and really bad stomatitis. Now there's a word called Codal Mucositis. So this is the telltale sign of this condition. Even in the developed world, there's no specific test or anything to diagnose this condition. It's always from the clinical examination. So this Codal Mucositis, or the redness at the caudal at the back of the mouth, is the telltale sign of this feline Geostomatitis. Now if you go to the clinical signs, now a cat will present to you with clinical signs like the owner will tell there's a little bit of drooling and some degree of halitosis, and also at times reluctant to eat the hard food. He will prefer the soft food. And also when he's chewing on the food, suddenly he screams and stops eating. And also even when he's not eating, but when he's yawning, kind of a nice yawning, and then he screams in pain and stops being relaxed, kind of. So all these things are due to the pain here. Now the cause for this disease, feline Geostomatitis, is poorly understood as of 2022. So there's no 100% consensus, but it's thought to be an immune reaction, autoimmune kind of a reaction. So it's thought to be inappropriate immune reaction to plaque or calculus, which is the dirt material that accumulates on the teeth. So what is meant by inappropriate is, now if it is, say, if it is appropriate, you would expect slight degree of redness or slight degree of gingivitis when there are slight degree of plaque or this gray unnecessary matter. And when there's a significant degree of plaque or gray matter, you would expect a significant degree of redness or inflammation. So that you can call as appropriate. Inappropriate means whether you get these plaques or not, you get a massive reaction. So that's the typical characteristic feature of this one. So inappropriate reaction, and also the telltale sign is this Codal Mucositis. And treatment wise, as of now, earlier historically there has been several things tried, like antibiotics have been tried, NSAID painkillers like meloxicam have been tried. All those things have been tried, but none of them will give a like 100% or at least satisfactory response, or to establish satisfactory good quality of life. So now the recommendation is full mouth extraction, where you remove all the 30 teeth of a cat. Even though it sounds like very dramatic, that's a common procedure carried out in all these countries. And now what the basis of this is, now when you do the full mouth extraction, there are no surfaces for the dental plaques to bind to. So less foreign material in the oral cavity, and then the immune reaction naturally subsides. So that's the rationale of doing the full mouth extraction. Some people, without going for full mouth extraction, they go for a thing called Codal mouth extraction, where you remove all the cheek teeth, where you keep all the incisors and the canine. 16 teeth, front teeth you keep, and you only remove the 14 back teeth. So that's called Codal mouth extraction. That's also is sometimes practiced with a significant success, but the ideal recommendation is the full mouth extraction. Now you would wonder how are they going to eat when there are no teeth in the mouth, but believe me, they will be much more happier and relaxed to eat without any teeth, only with the roughened gum, without having very painful teeth like this. So their quality of life increases significantly. They will feel significantly better. You can see it, and the owner will report it to you. It's a really quality of life increasing procedure. And this is just after 3 days of Codal mouth extraction. We haven't done the full mouth extraction. We have only done the Codal mouth extraction. So this is just 3 days after the Codal mouth extraction. You can see a significant less redness here, whereas this has a significant irritation and redness. So the statistics wise, there are different statistics. This is one of the studies that we did. That matches with the normal international statistics also. So 50% of the cats full recover after the Codal mouth extraction. Full recovery means the time period is 2 months, 8 weeks. So from the procedure, from the date of the surgery, after 8 weeks, you do a final evaluation. At that time, without any medications, if there's no redness, no pain, then they are considered to be belonging to this 50% full recovery group. So they don't need any medication. We have cured them 100%. And another 25%, roughly 25% of cats are partial respondents, where the clients will not notice any pain. Clients will not complain of any drooling or any pain signs. But when you open the mouth and look inside, there will be slight redness. But this group of animals also, they don't need any medications. Their quality of life is like 90% okay. And the remaining 25%, unfortunately, are non-respondents. Even with full mouth extraction, these patients will not respond properly. So their pain and inflammation will persist. So to keep their quality of life better, we'll have to continue medicines even after this full mouth extraction. So the commonest medications historically used were prednisolone and cyclosporin, immunosuppressive doses. So the advantage of going for the full mouth extraction or Codal mouth extraction is usually, from our experience now, till the client decides about the surgery. Now, even for us, suggesting a Codal mouth extraction, 14 teeth or full mouth extraction is a dramatic thing. So the client will take some months or weeks for them to decide on the procedure. So until such time, we usually give a long-acting prednisolone doses, the dipomedrol doses. Usually, before tooth extraction, we have to give it like every 10 days, every 14 days to make reasonable quality of life. And even in this non-respondent 25%, after the extraction, most of the patients had to be given only once in 2 months, once in 8 weeks, dipomedrol injections to maintain good quality of life. So once in 2 weeks versus once in 8 weeks, that's a 4-time increase in the like reduction in the frequency. So that will significantly reduce the side effects of prednisolone. So even if this animal is a 25% non-respondence, by doing this procedure, you are going to definitely increase the quality of life. And also the possible complications like diabetes and all those things, side effects from the prednisolone injection. And also you can use cyclosporine 5 milligram per kilogram once daily. In other countries, they have cyclosporine syrup, but in Sri Lanka, we mainly have the cyclosporine capsules. You can get the liquid inside the capsule and get this dose. And in other countries, they have array of other medications like interferons and like radiotherapy and all those things, which are really advanced things, because even in the most developed world, this disease is a headache to the frustrating disease to the animal, vet, and the owners alike. Because they are in this 25% non-respondents, even in the USA, there's no 100% cure. So they have been trying all these different things like interferons, radiotherapy, cryotherapy, and all those things. And there are several number of new research is also going. But as of now, still some animals with all this medical knowledge, you can't give a 100% cure. So a little bit about the tooth structure. So as we know, there's a when it comes to a tooth, there are two parts, the crown part and the root part. So this is the crown part. Above this, now we call it cemento-enamel junction. Above that is the crown part, and below that is the root part. So in the crown part, you get the outer enamel, middle dentin, and the inner pulp. And the root part, you get outer cementum, middle dentin, and the inner pulp. So now this is a thing called gingival sulcus, where the gingiva and the crown meets. So this is the cemento-enamel junction, because in the crown you get the enamel here, and in the root you get the cement here. So this is a cemento-enamel junction, which is the dividing line between the crown and the root. And this tooth is embedded in a socket of the alveolar bone. So you get alveolar bone all this area, and it forms a socket, and in that socket is the tooth staying. And between the tooth or the cementum and the alveolar bone, there's a thing called periodontal ligament, which attaches the tooth into the socket properly. So the term periodontium includes tissues that surround and support the tooth. So that includes cementum, this cementum, and the periodontal ligament, alveolar bone, and the gingiva. So those four parts are the components of the periodontium. There are two other terms that we have to be familiar with in veterinary dentistry. One is dental plaque, and the other one is Tata or calculus. So plaque is this gel-like substance composed of food scraps, salivary components, and bacteria. So that's a gel-like whitish color, glistering kind of a substance where you can remove it by brushing or like by some mechanical means. And Tata or calculus is formed when the plaque is not removed, then it stabilizes, and this Tata is formed. Tata is this brownish color or the like this hardened substance that you normally see on the teeth of dog. So plaque starts to mineralize anything after 1+ day, 3 to 5 days. So even after 1+ day, you can the plaque can start to mineralize and form Tata. So that's why daily brushing is important. If you brush plaque, you can remove the plaque, and then there's no formation of Tata. Whereas once the Tata is formed, you can't remove it by brushing. You have to go for professional scaling. So this cannot be removed by brushing. The Tata cannot be, the brownish color Tata cannot be removed by brushing. Only the initial thing, the gel-like substance, the glistering substance called plaque is the thing that you can remove by brushing. So in the Tata, there are two types of Tata, supragingival and subgingival. Now, supragingival means above the gum line. You can normally see that in any dog, and the subgingival Tata or subgingival calculus is a part that you don't see, but that's the culprit of all this damage, because when there's Tata subgingival buildup with millions of bacteria, that gradually destroys the structures of the periodontium. So when there's subgingival Tata here, it destroys the cementum, it destroys the periodontal ligament, alveolar bone, and then ultimate result is the tooth loss. So periodontal disease, the definition is inflammation of the structures of the periodontium. That's mainly due to, one thing is plaque bacteria, and the other thing is when there's a lot of bacteria, the host responds to the bacterial insult, with all these like the chemicals, cytokines and all those things, so that those host response as well as the plaque bacteria will result in this inflammation. So that characterized by inflammation, apical migration of epithelial attachment and the bone loss. So now this is the cemento-enamel junction in this tooth. So this is the crown and this is the root. So apical migration means it go, now ideally the gum line should have been here. Gum line should have been here, but due to the accumulation of Tata for a long time, that those bacteria and the host response has destroyed all the periodontal ligament and the alveolar bone here. So you can see all this exposed root part. Ideally, the gum line should have been here. Here, ideally the gum line should have been here. Here at this stage. So this bone loss is essentially irreversible unless you don't use the tissue regeneration techniques, which are a little bit of advanced techniques. So periodontal disease, the culprit is the plaque bacteria and the host response to the bacteria. And when it happens here, there's a thing called apical migration of the attachment of the tooth thing, and then there's attachment loss. Now there's a significant attachment loss here, which causes this is a permanent damage. Sometimes up to a certain degree of damages, you can regenerate by guided tissue regeneration techniques. So there are three terms again: periodontal disease, endodontal disease, and orthodontal disease. We know peri means the periphery. So periodontal disease means it's like not the tooth proper outside, all the periodontal tissues, the four structures that we told, the cementum, the periodontal ligament, alveolar bone, and the gum line. So those are the periodontal disease. And endodontal disease is the destruction of the tooth proper, which are not very common in animals because they don't have. In humans, you get all those things because we eat acidic food and our the surface of the tooth is like very flattened. So there's surface for the acidic matter to accumulate. So therefore, these tooth caries, dental caries is a less common thing in dogs and cats, but it happens, but less common. So anything to do with the tooth proper damages are called endodontal disease. And orthodontal diseases are the positioning of the issues with the positioning of the tooth here, like different angling, malocclusion of the teeth are called orthodontal disease. In other countries, sometimes you can correct those things also, like people use these braces and all these instruments. So these three words, periodontal disease, endodontal disease, and orthodontal disease, are worth remembering, because this encompasses the whole veterinary dentistry to a significant extent. So the periodontal disease do permanent damage to the periodontal ligament, cementum, and alveolar bone. Ultimate result is, one thing is chronic pain and discomfort. There will be significant and low degree and chronic pain, and ultimately tooth loss. So if this happens, if this periodontal disease happens in maxilla, you usually see a thing called oronasal fistula, the communication between the oral cavity and the nasal cavity. Now this area, ideally the canine tooth should have been here. Due to the bone loss, canine tooth has come out, so that the alveolar bone socket is also damaged. So there's a communication between the oral cavity and the nasal cavity. So this oronasal fistula is the tooth loss, and the oronasal fistula is the end result of the periodontal disease. Sometimes even if the tooth is there, you can get a oronasal fistula through the canine tooth. You can get some communication of food matter and all these things from the oral cavity to the nasal cavity. in the mandible, the worst case of periodontal disease will result in mandibular fractures, because when there's bone loss here, especially this happens when it comes to small breed dogs, where their mandibular, the thickness is really small, so you can get a fractures also here. And also the other damage that is caused by periodontal disease is bacteremia. When millions of bacteria is there inside the oral cavity, millions will enter the bloodstream gradually at a very low level. So infective endocarditis, issues to the lungs, liver, all these things can happen when millions of bacteria enter the bloodstream, causing bacteremia daily. So prevention of periodontal disease is prevention of supragingival and subgingival plaque accumulation. That's the baseline. So that's why the daily brushing comes into play, because with brushing, daily brushing, you can remove all the plaque. So when the plaque is no more there, there's nothing, there's no raw material for the dental calculus or the dental, the permanent thing to form. So daily brushing will definitely significantly reduce this subgingival and supragingival issues here. And if you, apart from daily brushing, you can give dental treats. Now, if the treats are of good quality, they will have a significant effect on reducing the Tata and plaque. And also failing all these things every 2 to 3 years, or depending on the severity of the condition, you can go for professional scaling under anesthesia. But only thing is, now, just because you do a professional scaling, that doesn't warrant anything if you don't do the daily brushing at home. Because now, say if you do the professional scaling today, within about 6 months or 3 months, you would see a significant redevelopment of the Tata and calculus. So this sentence is a very useful sentence. The benefit of any professional periodontal therapy is short-lived unless maintained by effective home care. Effective home care mainly means the daily brushing, and if they have dental treats. So the prevention is prevention of this plaque accumulation by these means: daily brushing, dental treats, and also occasional intermittent professional scaling under anesthesia. And this slide I included just for us to have an idea about the advanced developments in the world in the veterinary field of veterinary dentistry. Now, all these orthodontic procedures are done not maybe very on a commercial basis, on a research kind of basis, but these can be done. And these are routinely done commercial basis. This is now when there's a endodontal disease, you do the nerve filling, root filling. That's a common procedure, especially in veterinary dental specialist clinics. And this is now this whitish thing is the bone graft material. You can buy them commercially, bone graft material packs you have. And when there's a significant attachment loss here, you can remove all the debris, and then you can instill this bone graft material. And then you have things called 2-week kind of acting topical preparation of antibiotics. You add them also, and then you suture, and then you can expect a significant degree of tissue regeneration. And this one is a titanium artificial tooth here. So those kind of things are also practiced in the world. These may be not really common. This may be like very less frequent, but this is very common in dental specialist practices. And this is also very common even in the normal practices. Even for clinicians like us, we can do these procedures if we have this commercial material. So dental radiograph is also another area which we still don't have in Sri Lanka for veterinary dental thing. So this is a digital dental radiographic machine. You have a, it's a like a movable kind of a thing, or you can do it as a wall mounted thing also. So there's an arm here. That arm is a movable arm. You can place it in different angles. So this is a close-up view. This arm, you can place it in different angles. And this is the X-ray plate. It's an intraoral X-ray plate, a digital film. You put it inside, and then you get put it inside in different angles. There is a specific way of taking a thing called full mouth radiograph in dogs and cats. But all these procedures are done under anesthesia. So they are expensive, not cheap. And the the handy thing about this full digital dental radiograph is as you press the button, you get the image here. And also they are arranged in one specific order, so you can get 100% proper idea about the periodontal structures and all the unexpected things in the bone. So oral issues, even though historically they were thought to be old dog issues, they are in fact not old dog issues anymore with all the knowledge that we have in veterinary dentistry as of now. And chronic periodontitis is an extremely common problem in dogs and cats even at a very young age. So it's not an old dog disease. It's an old dog issue as long as we are not sensitive to that problem and we don't have the appropriate knowledge. Otherwise, if you are like sensitive to these issues, it's no longer a old dog issue. So the statistics say the majority of more than 3 of old animals have a degree of periodontal disease that warrants treatment. So this is a very nice sentence that I use for my WSAVA lecture also. The amount of pathology found in the oral cavity would never be tolerated in any other part of the body. Because now most of the people, even in the other countries, they would say there's some degree of smell from my dog's mouth. He's an old dog, so that's expected. So that's not the reality. That is not the correct approach. Now when it comes to a skin issue, say even if there's a tiny nodule kind of a thing or tiny abscess kind of a thing, tiny redness kind of a thing, owner would come to you only for that, saying that there's an issue there. Whereas that's what this sentence says is amount of pathology found in the oral cavity would never be tolerated in any other part of the body. If it's a skin issue, it will be like the owner will be paranoid. But when it comes to oral things, they are not like that, because one thing is they don't have that knowledge about the veterinary dentist. So it's our duty as veterinarians to educate them, and ultimately it results in good animal welfare, and also it's good for the practice, because dental things are a new thing, and it's a really good source of income, and also it establishes the good quality animal welfare also. So with that knowledge, the take home message that you can have some targets if you are interested in veterinary dentistry, and if you have your own practice, or even if you work for another hospital. Now these things are the things that you can do to improve the status of the veterinary dentistry at your practice. One thing is include a quick oral health examination in all routine consultation of dogs and cats. Say a dog comes for a vaccination routine appointment, apart from the normal looking at gum color and checking heart and lungs and spleen and all those things, just 30 seconds of oral cavity examination. Then a lot of disease conditions will surface, and then you can guide them for a treatment. So ultimately the patient also benefits, and also your practice also benefits from that as far as the financials are concerned. And also the second thing that you can do is to draft a dental leaflet with some information, general information for the clients, and with your hospital logo. So that's going to be a really good way of advertisement for you also. And you also have to educate all your assistants, technicians, nurses, and the reception front desk staff, because sometimes the clients will have more connection with them. So if they also have a basic understanding about this, the dental issues, they will also, when they have a casual chat with owners, they will also mention these things, and then they will be convinced. Now you tell one time, and then when they go out or when they come for a second time, the nurse or the assistant goes there and looks at the mouth and says, now this is high time for you to go for a dental scale kind of thing. So that will definitely help your practice also. And also ultimate thing could be like buying some proper instruments among the other handheld instruments and a dental machine. Final goal should be to buying a dental x-ray. Say if you generate some income, significant handy income from these things, and I assure you that you can generate a significant extra income from dental procedures, apart from the income that you generate now from the normal procedures. So if you accumulate those amount of money, you should be able to go into this target definitely. And so now this is Dr. Nemik, who is the chairman of the Global Dental Committee of the WSAVA. And I will have a word about this WSAVA for people who don't know about it. Now, this stands for World Small Animal Veterinary Association. That's only for the small animals, Small Animal Veterinary Association, and all the local small animal associations are the members of this WASAWA. For instance, in Sri Lanka, we have a thing called SCAP, Society for Companion Animal Practitioners. So that's the small animal body in Sri Lanka. So that institution is a member of WASAWA. So WASAWA is made up of all these local institutions from different parts of the world. And they have different committees, vaccination committee, nutrition committee, all those committees, and global dental committees, one such committee. So now I represent as a member to this global dental committee, and initially the dental committee only had specialists where they drafted this dental guidelines, and now they have chosen normal doctors, general practitioners who are interested in dentistry to propagate this the message about the dental veterinary importance of veterinary dentistry. So that's another thing that I wanted to inform you apart from the theoretical knowledge. And thank you very much. So if you have any questions, I'm happy to entertain a few of them.
Thank you, Dr. Chandika. This is the second time I heard his lecture about the same topic. We had a very good lecture series as well as a practical session last year with the collaboration of the SCAP and the SLVA. And I hope all the audience could get the good information as well as a good knowledge about the veterinary dentistry. Actually, I would like to open the forum for your queries.
And before you, till you compose your questions in this slide, this is also a common problem which we don't diagnose regularly. Now, can you see now there's redness here, and redness here. So now corresponding to this tooth, there's a redness here. To this tooth, there's redness here, and to this tooth, there's redness here. Now, this is the gum everted. So, yeah. Yes, Dr. Man.
Yeah.
Yes, Dr. Man.
Dr. Chandika, you can go ahead.
Can you hear me?
Yeah, Dr. Susant, I can hear you.
Dr. Chandika, you can go ahead because Dr. Nuwan is having some technical issue.
All right, okay. So what I was trying to tell is this diagram here. So now this we have everted the lip here. Now ideally, now in the natural position, this lip is downside. So this area is the area where it touches this tooth, and this one, this area, and this tooth is touching this area. So there's some degree of inflammation, and here significant degree of inflammation on the area where the gum touches the tooth. So that
screen.
So that is called a thing called the normal term is kissing lesion, because this tooth is kissing this lip line here. This tooth is kissing this lip line. So it's called kissing lesion, and in scientific terms, it's called CUPS, chronic ulcerative paradental stomatitis, CUPS. So that's another significant dental issue that we normally overlook. So the treatment for this thing would be, now these kind of tiny ones, when you do a proper tooth scaling and anesthesia, these things will resolve. But for these kind of things, it's an anatomical issue here. So you have to extract this tooth. Otherwise, this is going to be a chronic never-ending wound. To establish the good quality of life, you have to extract this tooth. But these ones, you should be able to save by doing a professional scaling here. And this picture, the other picture is a inside view of the rabbit's mouth, where you have the tongue here, and we have opened the mouth using the rabbit mouth gag and the cheek dilators. I don't know whether this is very clear. This is one of the pictures that we took during one of the procedures. Now here the tongue base has a significantly big and painful ulcer here due to the spike here. So after we trim this thing, within about few days, the rabbit becomes perfectly okay. Yeah, if you have any questions, I'm happy to answer a few of them.
Dr. Chandika, this is my personal question. What are the good health practices to improve the dental health? It means that the most of people are now having the practice to the rearing the guinea pigs as well as the rabbits in their houses, and there are many dental issues. I hope sometime I always refer to you as well. So what are the homemade practices we can use for the minimize the dental issues in that kind of the small mammals?
You mean dogs or dogs and cats, or the rabbits and squirrels kind of ones?
In generally, if you tell about dogs and cats first, then the other squirrel and the other mammals as well.
So dogs and cats, the answer is very easy. It's just to maintain the oral cavity without the periodontal disease. That means without plaques and Tata. So that means, as we mentioned in one slide, the baseline is daily brushing of the tooth. And also, like if you have like good quality dental treats, dental chews kind of things, so those two practices will prevent accumulation of Tata and plaque that will ultimately reduce, so prevent the possibility of developing the periodontal disease. Because in dogs, 90% of the diseases are in the oral cavity are periodontal disease. So if you, by what we meant by good oral health practices is mainly daily toothbrushing, and also if possible to have dental treats. In rabbits and squirrels and guinea pigs, you don't normally get those kind of periodontal disease due to plaque, maybe due to their different type of food. They mainly get those two conditions that we mentioned. One thing is the incisor overgrowth, and the other thing is the spikes at the back of the teeth. So to prevent or minimize them, one practice is to give them rough edges. Now, ideally, they are like fiber eaters. Now, even though the famous cartoons say the rabbits eat carrot, it's just a myth. They are meant to eat rough edges. So if you provide 75% of rough edges like to your rabbit, then at least some degree of pathological growth of the tooth will reduce. But unfortunately, now some of these things, especially the incisor overgrowth, will happen due to other reasons other than not having the fibrous food. Like genetically, some rabbits will have some malocclusions. So when there's a malocclusion, when there's no proper occlusion, the other tooth can grow freely. And also sometimes you notice the rabbit is perfectly okay for the first 4 or 5 years, and all of a sudden you notice elongation of the incisors. That normally happens after a fall or something like that. If the tooth root changes, the direction changes, then it grows in a different angle. So there's no friction from the other tooth. So that's another thing. But for those kind of things, apart from preventing the fall, you can't do anything. And also when it comes to genetical skull malformities, also you can't do anything. So there are some rabbits that we have every 2-3 months under anesthesia, we trim the teeth. But for dogs and cats, you can maintain a significant good oral health by daily brushing and offering dental chews.
Dr. Chandika, I have a question.
Yes, Dr. Janari.
Is there a special age to start brushing the teeth in dogs? And also, if we are starting brushing the teeth in an old one, is there any technique or how to train them, something like that? Can you explain a little?
Yeah, ideal thing is to train them when they are like really young. What I meant by really young is like even when they're about 4 or 5 weeks is okay, but there's a new thought now. Now when they're about 2, 3, 4 months is the time where their deciduous teeth fall and the permanent set of teeth erupt. So sometimes there's a thought that if you try to brush the teeth during that time, due to the pain, he will incorporate or associate it with a bad experience. So therefore, some people suggest that you can start the daily toothbrushing after 5 months or so. There's no consensus always. Some people say even if you don't use a toothbrush, you can use your finger or a small soft cloth kind of a thing and start as early as 2 months kind of. And when it comes to a training of an adult dog, sometimes it can be challenging because when you come with a toothbrush or finger poking inside, it's a novel experience to him. Sometimes he may not cooperate. But if you want to try, the approach would be like this. Now, I would choose one specific time of the day, whether it's in the morning or evening, what is the best time for you. If you are free during the night, I would choose the evening time. And also choose a specific place of the house, whether it's in the living room when you are watching TV or whether it's in the kitchen, one specific place and one specific time, and daily. From the starting day, daily you have to do it at that time and at that place. And initially you can just do it only for about 10 seconds or 20 seconds the maximum. And the good thing about dogs is you don't have to brush the inside surface of the teeth. You only have to brush the outside surfaces. So 4 outside surfaces. So just mingle with your finger for a few seconds and then stop it. And you can give a treat after that. So daily you increase the time that you spend, and also gradually when he's a little bit cooperative, you can use a thing called finger mounted toothbrush or even a pediatric toothbrush kind of a thing. It's a gradual process where you need a lot of patience. It's like a training a adult dog for any other procedure. And what research says, when you do it for 21 days and more, a habit is formed. That doesn't mean he may like it, but a habit is formed so that at least there will be some degree of cooperation from his side.
Thank you.
Secretary, I think our moderator has been disconnected, so you can continue.
Yes, now only he is joining. If there are any other questions, you can ask now. Are there any more questions?
If there are any questions and if you don't want to ask in public, you can always email me or WhatsApp me. I'm very poor at answering your calls real time, but I will respond to emails and WhatsApp messages.
Thank you, Dr. Chandika, for nice presentation.
You are welcome.
So, if there are no other questions, on behalf of the Sri Lanka Veterinary Association, I would like to thank Dr. Chandika Wickramasingha for accepting our invitation today and delivering a very good speech and a very good presentation. Actually, this presentation is very clear, and he has presented it very simply. So I'm sure audience today gain very good knowledge about veterinary dentistry. So thank you, Dr. Chandika, again for your very informative presentation. Next, I would like to thank our former secretary, Dr. Sugat Pemachandra, for arranging this webinar series. Thank you, Dr. Sugat. Next, I would like to thank our president, Dr. Susanta Malavarachi, for being with us here today. And also, my special thanks goes to the 74th Executive Committee of Sri Lanka Veterinary Association for their continuous support to conduct this webinar series. Next, I would like to thank our audience today, those who are participating from Sri Lanka, and also there are a number of participants who have joined from other countries, especially India and some other countries. So thank you very much for joining with us today. I hope all of you have gained a very good knowledge about veterinary dentistry. And finally, I must invite you to join our next webinar, which will be on 15th May at 1 o'clock Sri Lanka time. Please join on 15th. The topic is Feline Clinic and Problem-Based Approach. And this webinar will be conducted by Dr. Yushika Dharmasurya. So thank you very much again for joining. And also, if you missed any part of this presentation, and those who have missed the presentation today, they can watch later this presentation, the webinar, by joining our YouTube channel, Sri Lanka Veterinary Association YouTube channel, as well as Sri Lanka Veterinary Association Facebook page. Thank you very much.